A 28-year-old woman presents to the emergency department with palpitations, weight loss, excessive sweating, and anxiety for the past 2 months. On examination, her pulse is 120 beats per minute and regular. She has a diffuse goiter and prominent eyes. What is the most likely diagnosis? A. Hashimoto's thyroiditis. B. Graves' disease. C. Subacute thyroiditis. D. Toxic multinodular goiter. Comment your answer before reading the explanation. Correct answer: B. Graves' disease. Explanation: this patient has the classic features of hyperthyroidism caused by Graves' disease, weight loss despite a normal or increased appetite, palpitations and tachycardia, heat intolerance and excessive sweating, anxiety and tremor, diffuse enlargement of the thyroid gland, goiter. Eye signs: prominent eyes, which are characteristic of Graves' disease. Graves' disease is an autoimmune disorder in which antibodies stimulate the thyroid gland to produce excessive thyroid hormones.